Hey folks, Chadi Nabhan here with the Hem-Onc Pulse, the host of the Hem-Onc Pulse, and with Blood Cancers Today, on site in Chicago at the American Society of Clinical Oncology. And I'm here with Dr. Swetha Kambhampati, who happened to appear on the Hem-Onc Pulse previously. So tell us what you're presenting here at ASCO. And before you do that, just where you are, where you practice, and what you do.
Absolutely. Thank you so much for having me here. I'm Dr. Kambhampati. I'm an assistant professor at City of Hope in the lymphoma division, and I'm excited to be here at ASCO 2023. I'll be presenting at the lymphoma oral abstract session tomorrow on real-world outcomes of Brexucabtagene Autoleucel in relapsed refractory mantle cell lymphoma CIBM-TIR subgroup analysis study. And so this is a largest real-world study to date looking at safety and efficacy of Brexucabtagene in relapsed mantle cell. And we have 380 patients in the study with a median follow-up of 12 months, and we looked at overall response rates, and they were very comparable to that of ZUMA-2, an overall response rate of 90% and CR rate of 78%, with a median duration of response of 21.7 months.
So the patients were derived from the CIBM-TAR registry?
Exactly, 84 centers across the United States, and these patients' data were collected from July 2020 to December 2022, so a large database of study and the largest to date in looking at this.
Did you look, for example, at older patients? Because there's always the hypothetical concern that older patients may not tolerate CAR T therapy.
Yeah, great question. The median age of the population was about 67, so it did include an older population in the study itself, and it was real-world patient characteristics. These are patients getting it in our day-to-day practices, so it included patients with high-risk disease features. We had median 4 prior lines of therapy ranging from 1 to 12, 20% had TP53, 17-bit deletion, 44% had high Ki67, so really heavily pretreated high-risk patient population included older patients, whatever the real-world patient population receiving.
And patients were not always treated in high-level academic centers, like some of them had like community sites, or? It
was 84 centers, so really captured a large base, but the facility had to have the ability to give CAR T-cell therapy, any center that was giving this treatment in the United States.
You told us about the efficacy and the responses. How about toxicities? Did you see toxicities differ between the ZUMA and the real world?
Yeah, great question. So in terms of CRS and ICANS, we saw an overall any grade CRS of 88% and ICANS of 60%, and high grade 10% and 28% respectively. So overall pretty comparable to the ZUMA-2 study. We also looked at other toxicities of interest, and 21% of patients had prolonged thrombocytopenia, 41% of patients had clinically significant grade 3 or higher infections, and 6% of patients had subsequent neoplasms. So, you know, the safety profile appeared to be fairly comparable, at least in the CRS, ICANS, and infection rate to that reported in ZUMA-2 in this real-world patient population.
Well, many congratulations. This is great and much needed data to really compare what happens in clinical trials, out of clinical trials.
Absolutely.
Thank you so much for sharing this experience with us, and congratulations, and look forward to having you on a subsequent podcast.
Thank you so much. Really appreciate it.